Hello everyone, my name is Mao Xin. The subject of this presentation is nurse bullying in the hospital environment. I will talk about the effects of bullying on the health workplace and patient safety, and how to use leadership to resolve the nurse bullying and make a healthy workplace and protect patient safety. I'm going to talk about the background of nurse bullying in hospital, the negative effect of the bullying on the nurses, workplace, and the patients. Some solutions for nurse bullying will be suggested, and the importance of clinical leadership in resolving this issue in hospital will be discussed. In the end of this presentation, I will give a summary and conclusion about this topic. Nurse staff are the largest group of healthcare professionals in hospital. Nurses play an essential role in delivering safe health care and developing health workplace culture. Studies suggested that 80% of nursing staff have the experience of bullying during their nursing career. Around one-third of first-year nurses experienced verbal conflict, which includes rude words, humiliating statements, and unjust criticism. Bullying can be defined as a situation where a person perceived to be targeted by negative actions persistently. Bullying behavior often happening among nurses include belittling, excessive criticism, being allocated an unfair workload, being excluded, being humiliated, or ridiculed about work, having opinion ignored, and having one's rumors read. Nurse bullying has a significant impact on workplace culture and patient safety, so it needs to be prevented. Studies showed that bullying behavior has a positive relationship with the psychological or behavioral responses of nurses, such as stress, anxiety, and medical errors. Bullying causes significant amount of financial, physical, and psychological costs to the victim, the patients they look after, their colleagues, and the hospital. Nurses who experience bullying are found to be more likely to develop negative perception about the workplace, low job satisfaction, and have anxiety and depression. Its effects on the hospital include job dissatisfaction, absenteeism, low productivity, staffing shortage, and decrease of commitment to the hospital, which makes the workplace unhealthy. Poor peer relationship can contribute to medication and treatment errors, and so as to impact the quality and safety of patient care. The unhealthy work culture can adversely affect the patient's safety, lessens quality of patient care, and causes the increased mortality and morbidity. The solutions: workplace bullying should be viewed as a systemic issue rather than an individual issue. It is important to examine the workplace structure and policies to find out the contributing factors to bullying, which may be rigid and vertical hierarchy system, imbalance of power, job insecurity, and organizational restructuring. The contributing factors are also suggested to be fatigue, shift work without regular breaks, and a stressful and fast-paced working environment. In order to enhance the workplace culture, it is essential to improve staff quality by providing sufficient training and to decrease work stress by employing more staff, changing working environment, and training to manage stress. Supportive peer relationship would be built and maintained so that the risk of harm to patient safety is reduced. A healthy workplace should create an environment that values all staff equally and makes them feel respected and valued. Education needs to be given to enhance nurses' resilience, which is important to manage stress and protect physical and mental health. Moreover, a DESC technique is suggested to stop the bullying behavior. D stands for the description of the behavior. E is for expression of one's feeling about the situation. S indicates the suggestion for the alternatives, and C is the consequences from actions. The leadership is essential to ensure the bullying behavior is not tolerated in a facility. Although policies and programs have been set up to address bullying, staff who are not bullied are empowered to speak up if a bullying behavior is identified. Every staff should take a leading role in maintaining a good work culture. All staff, including new graduate nurses, must take responsibilities to behave in a good manner following the code of conduct and act to intervene when any negative behavior happens. Nurse leaders should develop ability in identifying risk factors, informing, controlling risks, and encouraging safe reporting. Support and education are essential for nurses to take responsibility of identifying bullying and controlling risk using organizations' policies when bullying is taking place. In conclusion, nurse bullying is a commonly happened hospital issue which has a significant harm to nurses' physical and psychological health, hospital working culture, and has jeopardized the quality and safety of health care. Some approaches are suggested to prevent bullying and reduce its effect based on systemic viewpoint rather than individual issue. Clinical leadership is very essential in recognizing bullying behavior and controlling risk using relevant policies. Education needs to be provided to enhance staff quality and foster healthy workplace culture. Thank you very much.